Trypanophobia, conquering the fear of needles. Hello there, and welcome to today's exploration of one of the most common phobias worldwide. If you're new here, consider hitting that subscribe button to join our community as we unravel the mysteries behind our deepest fears. Today, we're diving into trypanophobia, the intense fear of needles and injections that affects millions of Americans and people around the globe. So, let's begin our journey into understanding and overcoming this challenging fear. Introduction: the invisible enemy. Imagine this. Sarah, a 32-year-old marketing executive from Boston, sits in her doctor's waiting room. Her palms are sweaty, her heart races, and she contemplates making a run for the exit. Is she waiting for major surgery? A dangerous medical procedure? No, she's simply due for a routine flu shot. For Sarah and approximately 25% of American adults, the sight of a needle triggers an overwhelming fear response that can lead to avoiding essential medical care altogether. Trypanophobia isn't just being squeamish around needles. It's a recognized phobia that can have serious health consequences when it prevents people from seeking necessary medical treatment, whether it's vaccinations, blood tests, or other medical procedures involving needles. This fear can significantly impact one's quality of life and health outcomes. The science behind the fear. So, what exactly happens in our brains when we encounter needles? Let's break down the science. When someone with trypanophobia sees or even thinks about needles, their sympathetic nervous system, our body's fight or flight response, kicks into high gear. This triggers a cascade of physiological reactions: increased heart rate, elevated blood pressure, sweating, dizziness, and in about 15% of cases, vasovagal syncope. That's the medical term for fainting. Interestingly, this fainting response is somewhat unique to needle phobia. Dr. James Hamilton, a psychologist from the University of California, explains that this vasovagal response actually involves a two-phase process. First, blood pressure and heart rate increase dramatically, the typical fear response, but then suddenly drop, causing reduced blood flow to the brain and resulting in fainting. This response may have evolutionary roots. Some researchers theorize that fainting might have offered protection to our ancestors when faced with penetrating injuries by reducing blood loss. Origins of needle fear. Where does this fear come from? For most people with trypanophobia, their fear stems from one of several common sources: traumatic experiences. Mike from Denver still vividly remembers being held down for a vaccination at age 4. 4 nurses had to restrain me, he recalls. I was screaming and crying. Even now, 30 years later, I can feel that same panic rising whenever I need to get a shot. Negative or painful experiences with needles, especially during childhood, can imprint deeply on our psyche. The brain essentially creates a powerful association between needles and danger or pain. Observational learning. Jennifer from Seattle never had a bad experience with needles herself. However, she witnessed her older brother having a severe panic attack during a blood draw when she was just 6 years old. Seeing him so terrified made a huge impression on me, she explains. I somehow absorbed his fear and made it my own. This phenomenon, known as vicarious learning, demonstrates how we can develop fears simply by observing others' fearful responses. Genetic and evolutionary factors. Some research suggests a genetic component to needle phobia. Dr. Lisa Patterson, a psychiatrist from Chicago, notes, "We often see trypanophobia run in families, which could indicate a genetic predisposition. However, this could also result from learned behavior passed down through generations." From an evolutionary perspective, our brains are wired to be cautious about sharp objects penetrating our skin. It's a reasonable survival mechanism. For some people, this natural caution escalates into a full-blown phobia. Real-life impact. The consequences of needle phobia extend far beyond momentary discomfort. Let's look at how this fear affects real people. Medical avoidance. Tom, a 45-year-old teacher from Austin, avoided doctors for over a decade due to his fear of potential blood tests. I knew I should be getting regular checkups, especially with my family history of diabetes, he admits. But the thought of a needle in my arm was more terrifying than the possibility of undiagnosed illness. This medical avoidance is one of the most serious consequences of trypanophobia. People may skip essential vaccinations, delay necessary blood tests, or avoid medical treatment altogether. Professional limitations. For some, this fear even impacts career choices. Jessica from Miami wanted to become a nurse since childhood, but abandoned her dream after realizing her severe needle phobia would make certain aspects of the job impossible. I couldn't even make it through the first semester of nursing school, she says. The clinical rotations involving injections and IV placements triggered such severe anxiety that I had to withdraw. Social embarrassment. Many people with trypanophobia report feelings of shame and embarrassment. As a 6'2" construction worker, it's humiliating to nearly pass out over something as small as a needle, explains Robert from Philadelphia. My coworkers would never let me live it down if they knew. This social stigma often prevents people from openly discussing their fear or seeking help. The spectrum of fear. It's important to understand that trypanophobia exists on a spectrum. For some, it's a mild discomfort. They don't enjoy getting shots but can manage with minimal distress. For others, it's a debilitating phobia that triggers panic attacks, fainting, or complete avoidance of medical care. Dr. Michael Reynolds, a psychologist specializing in phobias at NYU, explains, "We typically categorize needle phobia into 3 levels of severity. Mild cases involve anxiety, but the person can still undergo procedures. Moderate cases may require significant support and anxiety management techniques. Severe cases often involve extreme avoidance behaviors and physiological responses like fainting." Breaking the cycle. Treatment approaches. Now for the good news, trypanophobia is highly treatable. Let's explore some effective approaches to overcoming this fear. Cognitive behavioral therapy, CBT. CBT is considered the gold standard for treating phobias. This approach helps individuals identify and challenge irrational thoughts about needles while gradually facing their fears in a controlled environment. Amanda from Los Angeles shares her experience. Through CBT, I learned that my catastrophic thinking, "I'll faint, humiliate myself, and the needle will cause unbearable pain," was driving my anxiety. My therapist helped me replace these thoughts with more realistic ones and gradually exposed me to needle-related situations. Applied tension technique. This specific technique was developed to prevent fainting during needle procedures. It involves tensing the muscles in your arms, torso, and legs to increase blood pressure, counteracting the drop that leads to fainting. I was skeptical at first, says Brian from Chicago, but learning to tense my muscles at strategic times during blood draws has prevented me from fainting for the first time in my adult life. Medication and medical interventions. For some individuals, anti-anxiety medications may be prescribed for specific needle procedures. Additionally, topical anesthetics like EMLA cream can reduce physical pain associated with injections. Distraction techniques. Simple distraction can be remarkably effective. This might include listening to music, watching videos, engaging in conversation, or using virtual reality during procedures. Mark from San Francisco found an unexpected solution. "I started bringing complex math problems to solve during blood draws. Focusing intensely on calculations completely distracts my brain from what's happening with the needle." Exposure therapy. Gradual exposure to needle-related stimuli can help desensitize individuals to their fear. This might start with simply looking at pictures of needles, progressing to watching videos of injections, handling syringes without needles, and eventually building up to actual injections. Success stories. Overcoming the fear. Let's hear from some individuals who have successfully managed their trypanophobia. Emily's journey. Emily, a 28-year-old graphic designer from Portland, had avoided medical care for years due to her needle phobia. When she became pregnant, she knew she needed to address her fear. "I couldn't let my phobia affect my baby's health," she explains. "I worked with a therapist who specialized in phobias, and we used a combination of exposure therapy and CBT. We started with just looking at pictures of needles, then progressed to watching videos. Eventually, I could hold an empty syringe without panicking." By her third trimester, Emily could manage blood draws with minimal anxiety. "I still don't love needles, but I can get through procedures without the debilitating panic I once experienced." David's breakthrough. David, a 52-year-old accountant from Dallas, developed a severe case of trypanophobia after a painful spinal tap in his 20s. For decades, he avoided medical care until he was diagnosed with a condition requiring regular blood tests. "My doctor recommended a psychologist who used virtual reality therapy," David recounts. "I would wear VR goggles that simulated being in a medical environment, while the psychologist guided me through relaxation techniques. Over several sessions, the virtual scenarios included more direct needle exposures. This approach, combined with applied tension techniques, allowed David to manage his necessary medical procedures. I've gone from someone who would rather risk serious illness than face a needle to someone who can sit through blood draws with manageable anxiety." Practical tips for managing needle procedures. If you're facing a needle procedure soon and don't have time for comprehensive therapy, here are some immediate strategies that might help. Before the procedure. 1. Be honest with healthcare providers. Let them know about your fear. Most medical professionals have experience helping phobic patients and can adjust their approach accordingly. 2. Bring support. Having a trusted friend or family member present can provide comfort and distraction. 3. Schedule smartly. Book your appointment early in the day to minimize anticipatory anxiety. Practice relaxation techniques. Learn deep breathing, progressive muscle relaxation, or meditation beforehand. During the procedure. 1. Don't look. There's no rule saying you must watch the needle. Look away, close your eyes, or focus on a specific object in the room. 2. Use distraction. Listen to music, play a game on your phone, or engage in conversation with your support person or the healthcare provider. 3. Apply the tension technique. Tense the muscles in your legs, torso, and arms, but not the arm receiving the injection, for about 10 to 15 seconds, then release slightly without completely relaxing. Repeat as needed. 4. Controlled breathing. Breathe slowly and deeply, focusing on the sensation of air entering and leaving your body. 5th, request to lie down. If you have a history of fainting, ask to receive the injection while lying down. Helping children with needle fear. For parents, helping children manage needle fear is particularly important. Early positive experiences can prevent lifelong phobias from developing. Sarah, a pediatric nurse from Minnesota, offers these suggestions. 1. Be honest but calm. Don't lie about the procedure, but don't overhype the pain either. A simple "you'll feel a quick pinch, but then it will be over" is appropriate. 2. Avoid transferring your own fear. Children are highly perceptive. If you're anxious about their procedure, they'll pick up on it. 3. Use age-appropriate distraction. Bubbles, counting games, or favorite videos can be excellent distractions during the procedure. 5. Consider numbing creams. Ask your healthcare provider about topical anesthetics that can reduce the physical sensation. 5. Praise bravery, not the absence of tears. It's okay for children to cry during procedures. Praise them for getting through it, regardless of their reaction. The future of needle procedures. Medical technology continues to evolve, potentially offering new solutions for those with needle phobia. 1. Needle-free injection systems. These devices use pressure to create a high-velocity jet of medication that penetrates the skin without needles. 2. Micro needle patches. These contain tiny needles too small to trigger phobic responses, but effective for delivering medications. 3. Virtual reality distraction. Increasingly sophisticated VR systems are being developed specifically for medical procedures. 4. Improved numbing techniques. New fast-acting topical anesthetics are making the physical experience of injections less uncomfortable. Conclusion: facing your fear. Trypanophobia may be common, but it doesn't have to control your life or health decisions. With the right approach and support, most people can significantly reduce their fear response to manageable levels. Remember Emily and David's stories. Both faced severe needle phobia, but found ways to overcome their fear when necessary. The key is to acknowledge your fear without shame, seek appropriate help, and take gradual steps toward managing your anxiety. If you're struggling with needle phobia, consider reaching out to a mental health professional who specializes in anxiety disorders and phobias. Many offer specialized treatment programs for trypanophobia that can make a significant difference in just a few sessions. Your health is too important to let fear of needles stand in the way of necessary medical care. With patience and persistence, you can develop the tools to face this fear and take control of your healthcare journey. Thank you so much for watching today's video on trypanophobia. If you found this helpful, please consider giving the video a thumbs up and subscribing to see more content about understanding and overcoming our deepest fears. Remember, acknowledging your fear is the first step toward conquering it. Until next time, take care of yourself. Both your physical and mental health matter.